Good afternoon, everyone, and thank you for joining the SickKids Ask Our Experts webinar series. My name is Colin Henniger, and I am the Vice President of Major Gifts at SickKids Foundation. It is my pleasure to welcome supporters and friends of the Hospital for Sick Children to this March edition of Ask Our SickKids Experts. Today's topic touches everyone in some way. Whether it's yourself, a family member, a friend, or a colleague, we have all been impacted, especially over the last year, almost to the date when offices and schools started to close. But SickKids' focus on mental health is not just a year old. We are fortunate to see a glimmer of hope in many ways. That hope comes not just with vaccinations, but with the ability to be with others again, and to hear from the incredible leaders at SickKids who are working directly with patients and their families and collaborating to gain clear understandings from decades before this past year and for those years ahead. Just yesterday, the Slate Family Foundation announced $30 million in support of mental health initiatives, including a $10 million commitment to support the building of our new hospital and the mental health inpatient unit. We are grateful to the Slate Family Foundation and all of our supporters who believe in the vision of SickKids and that of child mental health and support us in so many ways. I have personally heard each of our esteemed leaders today share their research, and I am thrilled that you will too. I'm going to take our panel through a series of questions we have developed, incorporating questions received from you in advance, but please use the questions pane to submit new or additional questions you have to our host moderator. We will try our very best to weave them into our discussion. If anyone listening today or someone close to them is in crisis or feeling unsafe, we would like to remind everyone that children and teens in distress can contact Kids Help Phone on kidshelpphone.ca or 1-800-688-6868. And for more information on protecting your child or teen from suicide or self-harm, please visit aboutkidshealth.com, which has a wide range of resources available through its Mental Health Learning Hub. So without further ado, it is my pleasure to introduce our three panelists today. Dr. Sunita Banga, maybe you want to give a wave. Dr. Sunita Banga is the Associate Psychiatrist in Chief at SickKids and an Associate Professor of Psychiatry at the University of Toronto. She holds the TD Bank Financial Group Chair in Child and Adolescent Psychiatry and heads a world-leading clinical research program in pediatric anxiety disorders and depression. At SickKids, she co-leads the Transform Mental Health Care Delivery Implementation Arm of the SickKids Mental Health Strategy. A strong advocate of the importance of integrating mental health care into the physical health of children and youth, Dr. Sunita Banga is an international leader in pediatric anxiety disorders and has published extensively in peer-reviewed journals and written several books and book chapters. Welcome, Sunita Banga.
Thank you.
Dr. Daphne Korczak, welcome. Dr. Korczak is the director of the Children's Integrated Mood and Body, or CLIMB Depression Program, a child and adolescent psychiatrist, associate scientist at the SickKids Research Institute, and an associate professor in the Department of Psychiatry at the University of Toronto. Her research activities focus on the relationship between early onset depression and future cardiometabolic risk, including obesity and the mechanisms subserving this relationship. Her secondary area of research is in child and adolescent suicidality, in which she is currently leading the first randomized controlled trial of a youth suicide prevention intervention in Canada. Since COVID-19, Dr. Korczak has also been leading a large collaborative initiative examining the impact of the COVID-19 pandemic on the mental health of children with and without pre-existing mental health conditions. Dr. Korczak is the author of over 50 publications and book chapters and is a sought-after speaker on the topics of depression and suicidality among children and adolescents for clinical and research audiences. She is the chair of the Research and Scientific Committee for the Canadian Academy of Child and Adolescent Psychiatry and chair of the Mental Health Task Force of the Canadian Pediatric Society. Welcome, Daphne. And Dr. Deborah Katzman, welcome. Dr. Katzman is a professor of pediatrics in the Department of Pediatrics at the University of Toronto and senior associate scientist at the Research Institute at SickKids. She co-established the Eating Disorders Program at SickKids in 1993. She was the head of the Division of Adolescent Medicine at SickKids from 2004 to 2012. Dr. Katzman is the Director of Health Science Research in the MD program at U of T. She is the past president of the Society for Adolescent Health and Medicine and the Academy for Eating Disorders. She's a member of the DSM Review Committee for Body Systems Disorders and immediate past chair of Specialty Committee for Adolescent Medicine and chair of the Examination Committee for the RCPSC. The focus of Dr. Katzman's research program has been to study the unique psychologic or physiologic and developmental issues in children and adolescents with eating disorders. She has published over 150 articles, abstracts, book chapters, and editorial. So please join me in welcoming Dr. Katzman and our entire panel today. So to jump right into the questions, Dr. Korzak, I'm going to start with you. Last month, you published a new research about the impact of the first wave of the COVID-19 pandemic on child and youth mental health. Thank you for doing that, and congratulations. Can you speak about the populations you looked at and what you and the research team found, and some takeaways there might be for parents concerned about their child's mental health, especially during this time?
Sure, I'm happy to. At SickKids in April, together with several other centers in Ontario, we launched a large study of the mental health impact of the pandemic on children and families. So this is among children with and without previous mental health and neurodevelopmental disorders, like autism spectrum disorder, for example. And we surveyed kids and families during the first lockdown, and we've continued to survey them over the past year. So from this, we found that nearly 70% of children experienced deterioration of their mental health during the first wave, during the first school closures. And we've also found that although a larger proportion of kids with previous mental health problems experienced deterioration of their mental health, approximately 40% of previously healthy children, so children with no mental health histories, also experienced significant mental health symptoms across all mental health domains. So really this speaks to us to the magnitude of the stressor of the pandemic. It also lets parents know that we shouldn't underestimate the potential impact of public health restrictions on how their children may be feeling or how their children may be managing.
And as a follow-up question to that, is there a good news story that you found or are able to share? Is there a certain population who is doing well, that is listening to advice and such, and really kind of breaking the bounds of your research?
Well, I'm not sure I would have thought of it as a good news story, but we did find that a much smaller proportion of children experienced improvement in at least one area of their mental health, around 20 to 30%. For example, having a pre-existing mental health diagnosis was associated with both improvements and deterioration in mental health. And so that tells us that there's a lot of variability among children with mental health conditions. And so for some children, for example, those who found the school environment socially or academically stressful, school closures may have provided some relief from sources of stress, leading to improvements in anxiety, for example. But for other kids, for example, children with ADHD, the loss of that structure and consistency in in-person social interactions had significant negative impacts on their mental health.
Thank you for sharing. And Dr. Monga, as Associate Chief of Psychiatry at SickKids, is what you're seeing across the hospital consistent with what we found in the study? And is there kind of a bird's eye view you can give to us about what's happening at SickKids since the beginning of the pandemic in terms of child and youth mental health? And what have you seen in terms of patient volumes as well?
Yeah, thanks, Colin, for the question. So I think it's really important to note that at SickKids, we're seeing exactly what we're seeing across the US and even Europe and England. What we saw was a little bit of a decrease in presentations for mental health disorders to our emergency rooms back in March and April of 2020. And then kind of over the summer, we started to see a resurgence to our kind of what we would call normal volumes. However, since the fall, like since September, we've seen this dramatic increase in volumes, increased acuity of mental health concerns presenting to the emergency department. So for example, in September, we saw 50% increase, and in the fall, September to December overall average, about a 25% increase in the volumes. So also some increase in eating disorders, and I'm sure Dr. Katzman will speak to that in a moment. But children and youth are presenting with concerns around anxiety, depression, suicidal thoughts, suicidal attempts, and the acuity of their distress and the severity of their symptoms, and also the younger age of presentation has really been concerning to our department. And we're seeing that across the US as well as, England and Europe, as I mentioned.
And did any of these changes, did you anticipate them or did they surprise you at any point?
Well, I think, I think all of us were a little surprised when the volumes to emerge kind of decreased in the early part of the pandemic. And we were expecting this increase at some point in time, but the volumes and the acuity, like that's been surprising to us. Like, I think we were expecting an increase, but the dramatic increase in numbers, like 50% increase in what we normally expect in September, or that average of 25% increase, and that younger age and the more severe attempts of suicide have really been concerning and very surprising in some sense.
Oh, no, thank you for that. Dr. Katzman, that was a great segue I think Dr. Munga gave for you, but earlier this year there was a significant media coverage about a growing shadow, and I'm putting shadow in quotations here, a pandemic of young people with eating disorders. From your perspective on the front lines, can you talk a bit about what you're seeing and how the surge in patients with severe eating disorders in particular is related to the pandemic?
Yes, thanks, Colin. So early in the pandemic, from about March to July, we were seeing about the same number of children coming into our outpatient, inpatient, and emergency room as we did prior to the pandemic. But as Dr. Munga has just told you, starting in August, and especially in November and December, we saw a surge in the number of young people with eating disorders, both in terms of those who were referred to our program and those who were presenting to the emergency room. So the numbers really increased, approximately increased about over 35%. Especially on our inpatient units, and those who were coming into the emergency room, they increased about 50%. And as a result of this increase, we had to open a second unit and resource that unit to manage the number of young people that we were seeing. These young people were sicker than what we had seen previously. They presented with significantly lower weights, they were severely malnourished, and many of them had a number of medical complications that are associated with young people with eating disorders. Things like low heart rates, abnormalities in the salts of their blood, low temperatures, brittle bones, growth failure, and I could go on. And not only were these kids really presenting with these medical complications, but they also had co-occurring mental health issues like depression and anxiety, which together with the medical complication made for very, very complex presentation for these young people.
And do we, as a follow-up, do we know why we're seeing this phenomenon now, or this increase or difference in patient volume and acuity right now?
I think we can only hypothesize at this point. And I think that I would say, and I think my colleagues would agree with me, that there is no one particular cause. This is probably the result of a number of factors that are colliding together. Many of the young people we are seeing are socially isolated, and I know that Dr. Korzak and Monka can speak to that. The school closures and lack of routine have really, I think, we're hearing from parents and kids that that's what's contributing to it. The disconnection from their peers, even though they're seeing them online, not having and being with them in the same room is really important in terms of their development. I think reductions in extracurricular activities can contribute to it. And young people are no longer in places where there are teachers and coaches who are very sensitized to eating disorders, who can pick these things up early. I would also say that there's probably, as a result of increased social media and exposure to increased social media, there's lots of messages, fat-phobic social media messages that may also contribute to these things. I think strains on families, parents who are not working, parents who are home, parents who are homeschooling, and this whole sense of this emerging phobia that we're calling coronaphobia, where parents are really concerned about coming into their primary healthcare provider or the emergency room. And so as a result of that, we're not seeing these young people as soon as we should be seeing them.
Thank you for that. And to open it up a little more broadly, Dr. Korczak, are there study results that might suggest possible contributing factors for the surge in mental health concerns we're hearing about today?
Yeah, so I'll just pick up from where Dr. Katzman left off. When I think about this study and what we are finding in our cohort of children, so this is, in this paper, we looked at about 1,400 parents and children, and in both situations for children with and without previous mental health problems, the single most important predictor of worsening mental health that we saw was the stress associated with social isolation that children experienced during the pandemic. So these are the feelings of loneliness, of frustration, of helplessness that kids have experienced about not being able to see their friends or see their teachers sometimes, or play on their sports teams, or have a birthday party, or go to their prom or graduate. All these things that the kids look forward to that help them sort of define their lives, and also ensure that they're reaping the rewards of all of their efforts for sometimes for several years.
Yeah. So
our study really highlights the importance of encouraging social interactions and supporting those for children wherever we can.
Absolutely. When I was introducing you, you all have your own specific areas of expertise, whether it's depression, anxiety, eating disorders. Could you each speak to the early warning signs of these conditions for parents and signs that they may need to get professional help, very much so from their primary care physician first? And maybe Dr. Monga, you could start by talking about anxiety disorders.
Yeah, no, I'm happy to. Thanks, Colin. I think, first and foremost, it's important to remember that anxiety is a bit of a normal feeling. We all experience a little bit of anxiety. It's probably a good thing to have a little bit of anxiety. And given the current situation with COVID, it makes sense to be a little bit more anxious, having a little bit more heightened anxiety. It's when the anxiety is persistent, excessive, or impacts or interferes in our lives or our children's lives. That's when one really needs to be concerned. And that's when you want to be thinking, is this kind of, bordering into a disorder? So I think as parents, if we're kind of noticing an increase in our child's anxiety, that it's kind of preventing them from having fun or getting their schoolwork done or sleeping, for example, that would be something to be concerned about. So, and if we wanted to kind of just really think about the signs and symptoms of anxiety, the physical signs and symptoms include, heart rate pounding, tummy aches, not feeling well, not being able to kind of, shortness of breath. Behavioral symptoms might include, avoidance of doing things, not wanting to come out of their room, not wanting to go to school, not wanting to socialize in any way that they can at this point in time. And then they may be expressing fears and worries. I'm worried about this happening or that happening. So, each parent knows their child best. And if they sense a change, that's when they should be thinking about presenting to their, primary care doctor, or if they see interference.
Great. Dr. Korczak, do you want to carry on that theme?
Sure. I mean, and anxiety and depression, it's not uncommon to have them overlap. And so you'll hear very similar types of things. I do see a lot of kids with depression, so I can speak a little bit more to that. And it's interesting because, some of what we have always said to parents to notice is when your child isn't participating in some of the activities that they usually would. And as Dr. Monga, was saying, in this environment, we have to be looking at some different kinds of markers than we normally would. So there's, withdrawal from recreational activities, for example, that's not going to be something that is going to be something that parents can notice, or in this environment, it's hard to do that. So that means for depression, certainly parents really do need to be checking in with their kids and asking them how they're feeling, saying, I've noticed that you seem to be staying in your room more of the time, or you seem to be having, difficulty with your sleep. These are some of the things similar between anxiety and depression that parents might notice. They might say, I noticed you don't seem as happy when you FaceTime with your friends like you used to. I don't hear you laughing like I normally would. Have you noticed these things too? And from there, thinking about, what's going on, what can you do as a parent or as a family to increase some time, to increase some of those activities, and then whether your child may need some additional help from your primary care provider or from a therapist.
Great. And Dr. Katzman, to round out the discussion from an eating disorders perspective, what should parents be looking for, and when should they seek assistance from their primary healthcare provider?
Yeah, thanks, Colin. Well, there's a number of signs and symptoms that parents can be aware of. The first is physical signs. So things like weight loss or failure to gain in height. In young girls, a loss of a menstrual period or irregular menstrual period. Young people often are ashamed of their behaviors and weight loss, and often what they'll do is they will wear baggy clothes. So that is another sign. In terms of their eating behaviors, we worry about changes in the types of food that are eaten. So often young people will avoid foods that have fat or carbohydrates. They may skip meals or avoid having dinner saying they've already eaten. They may be reading food labels, counting calories or counting grams of fat or measuring their food. Often young people will eat alone because they don't want their parents to see the types, kinds, or little food that they're eating. Many young people are interested in all things that are related to food, so they'll be cooking a lot or baking a lot or watching cooking shows. There may be young people who are consuming a large quantity of food in a short period of time, and parents find that food is missing. These are young people that may have signs or symptoms of bulimia nervosa. They may be spending a large amount of time in the bathroom after meals. And then there are young people who may be excessively exercising. And now with COVID being at home, parents can pick that up, I think, pretty quickly, and are often, with respect to exercise, if they miss a routine or miss a workout, feel very anxious about that. Parents should also, I think, be aware of purging behaviors, things like young people using laxatives or diet pills or water pills to get rid of the food or the calories that they're eating. And of course, there are other behaviors that Dr. Monga and Dr. Korsak have already mentioned, but these are things like increasing social isolation, young people complaining that they have poor concentration, irritable moods or low moods. These are all a number of signs or symptoms of an eating disorder. And if parents are worried, they should definitely contact their primary care physician.
Great, thank you. This is a question that's close to me as a father, but in your roles as clinicians and researchers, what factors have you observed to promote resilience in children and youth and families, and strategies parents can pursue to safeguard the mental health of their child? And just one last question, how should parents balance all the activities that they have with what the public health recommendations are related to the pandemic for the health that they feel is important for their child's mental health? So maybe Dr. Korsak, you could start us off with that big question.
Yeah, it's a huge question. And it's really an important one because you're right. It's front of mind for a lot of parents and for many of us. And, there are clearly many factors that have to be considered when making public health recommendations. Our findings from our study tell us that children's mental health has to be one of these factors. The struggle that we have that we've been having in our society is that to a reasonably large extent, we've been having an either or mindset with respect to viral transmission and mental health. Either programs and activities are running as they were pre-pandemic, or they're virtual or canceled. And what we're seeing in the results of our study is that we can't have an either or mindset. The impact on children is really too great. We have to prioritize children. We have to prioritize their mental health. And so we have to find ways to be creative, to problem solve, so that we continue to provide clubs and activities, maybe offer them outside when the weather allows, finding safe in-person ways of running sports or music or other programs. These kinds of factors, these are important factors really for allowing kids the opportunity to be resilient, right? We have to give kids an opportunity to demonstrate their non-academic strengths, their leadership strengths, and give them something to look forward to and motivate them to engage not just in school, but life in general.
Dr. Munger or Dr. Katzman, do you want to jump in if you'd like?
I don't think I have anything to add to what Dr. Korczak so eloquently said.
That's great.
The only thing I would add is that there are a number of things I think parents can do to help reinforce some of the things that Dr. Korczak was saying, and that is, especially in our populations, keeping a routine in place for young people is really important. Setting and sticking to a regular schedule is key. I think consistency and structure are calming during times of stress. I think Dr. Korczak alluded to sort of being creative about new activities for young people, having a family game night or something to look forward to. The other thing I would say is that we are bombarded by the news and by COVID news and all this bad news. And so I would really try and limit the consumption of this news as much as possible. The repetition of this kind of thing can be disturbing and confusing, and it may just be helpful to take a social media hiatus in all of this. The other thing is, I think it's really important for kids to be connected and stay connected to family and friends. And we have to do everything in our power to make sure that socializing plays an important mood or a role in these young people's lives.
And Dr. Katzman, that is a perfect, I don't know if you saw the next question, but that is a perfect segue into the next one around screen time, which, again, I as a parent think about all the time when a certain Disney movie comes on and it might just give us 15 minutes or half an hour. But prior to the pandemic, the typical concern was too much screen time for kids and adolescents. How those screens are now being used as a principal tool, as you mentioned, to stay in touch and to learn through virtual learning. Can you speak a bit more about screen time in general, the good, the bad, the ugly, and really what signs we should be watching out for kids and adolescents, and when we encourage it and when we don't?
Thanks, Colin. I think that the world has changed and there is no one right answer when it comes to managing screen time during this ongoing crisis. The reality is that it's hard to limit screen time right now, especially because kids are doing a lot of schooling and socialization, which we're encouraging. But I think safety first. And I think even before the pandemic, we had encouraged parents to monitor where their kids are going when they're using social media. And that still holds true right now during the pandemic. I think as parents, we need to know that in general, their child is, eating well and getting a balanced diet, that they're exercising, that they're spending quality time with family, and that they're using screen time wisely to be in touch with friends and also to do their homework. And if the answer to all of those questions are yes, then it's probably okay to be using screen time more than they would have prior to the pandemic. But if the reverse is true, like the teenager spending a lot of time alone in their room or scrolling social media, that could be a sign that other things are going on and worth an opportunity to discuss it with their young person. I think you have to balance screen time with other activities. It's always important to monitor the sites that kids are on. We also want to continue to encourage family time and activities with friends outside of screen time. So I think those are some of the things that I think people can think about.
And Dr. Katzman, we've had a question from the audience, which includes screen time, but in the case of excessive exercise or spending too much time on the screen or in the bathroom, should parents then start restricting these things since it's clear to them that's an issue? Or what kind of steps should a parents think about as they're noticing these behaviors?
If you're noticing these behaviors, it's time to have a discussion with your child or teen about the fact that you are really concerned about these behaviors. And if they need to be monitored or restricted because you're concerned about them, then I would move forward with that. But I would also say that if you're concerned about this, this is a perfect opportunity not only to discuss it with your team, but also to see your primary care provider.
Great. Thank you very much. This next question is going to come to you, Dr. Monga, but many parents are feeling overwhelmed by the present circumstances. Many have become full-time teachers, parents, and employees all at one time. Others are employed on the front lines who have lost their jobs. Could you give us some guidance on the importance of self-care and the impact of parent mental health on children and youth?
Yeah, thanks, Colin. I think that's such an important question, right? Like, I mean, there's a lot of focus on the kids, but I think it's really, really important just to validate and acknowledge it's really, really tough to be a parent right now. You're wearing multiple hats, and that's hard. And I think that's the starting point. Just saying, you know what, it's tough right now. I think what you said about self-care, that's the next really, really important thing, right? You know, as parents, you need to be mindful about what's going on in your lives, like, you know, and self-care. Being kind to yourself, you know, now is not the time to be the perfect parent, right? So giving yourself a little bit of slack is really important. And then just looking after yourselves as parents, right? So, you know, if you're not looking after yourself, it's going to be really difficult to look after your children. It's that kind of analogy on the airplanes. I know it's been a long time since many of us have been on an airplane, but, you know, put your oxygen mask on first before you put on the oxygen mask for others. So I think that's really important. So parents need to kind of just make sure that they're giving themselves a break. And, you know, just thinking about, you know, handing off to your co-parent if you can, and, you know, doing something for yourself, even if that means, you know what, the dishes are going to stay in the, you know, sink, and I'm going to go for a walk because it's a beautiful day. So, and I think also just parents recognizing that perhaps if their mental health is starting to become problematic, reaching out to their family physician as a starting point and getting that looked into.
That's great, thank you. Dr. Korzak, I'm going to turn to you for this next question, and it is kind of a transition from the last one around focusing on ourselves in the adult world, but can we also focus on family conflict? Because we know this year there's been so many added stresses, and everyone in close quarters, parents may be finding themselves in more conflict with their kids. How does family conflict impact child and youth mental health? What are some strategies we should look for and recognize when we start to see this as being harmful? And ultimately, what can we do to reduce it?
Yeah, I mean, thanks for raising this issue. It's really a great question. We know that family conflict has, you know, affects kids, and kids in this situation where they're maybe inside with their families for a prolonged period of time, those kinds of conflicts, you know, they might be hard to distract or escape from. So it is a really important issue, especially as this pandemic drags on. And it's important for parents and all of us, as Dr. Monga was saying, you know, to remind ourselves that this is not a normal way to live. Socially isolated, physically distant, sometimes in those close quarters with not a lot of our usual fun things to do. So families will get into conflict not uncommonly in these situations because, you know, it makes everyone a bit more irritable. And for adolescents, it's really the antithesis of normal adolescent development. You know, adolescents are trying to develop independence and autonomy, but parents are worried about where their kids are, how much screen time they're getting, keeping them safe. And so these things are you know, really naturally at odds with one another. So it's important in that situation for parents to remind themselves of these things, that this is not where their child is at developmentally. They're just trying to do what they are sort of meant to do developmentally and become more autonomous and independent. And this is a difficult environment to do that in. And then to notice when either the level or the intensity of the conflict is becoming a bit toxic. So that might be saying things you really don't mean, being unfair. You know, when the conflict starts to take up too much of the oxygen in the house, too much of the time, and that's the time to notice what's happening. Consider, you know, are we having enough enjoyable time as a family? Do we need to schedule that in a bit more? to our day or to our week. And as Dr. Mongo is saying, am I as a parent taking care of myself? Does my child have enough outdoor time? Do they have enough social interactions? What's sort of the priority here right now? And these are some of the things that parents can think about if they start to notice that the level of conflict in the house is escalating.
We just received a question from the audience, and if you please feel free to jump in, Dr. Korzak, you might be able to based on what you just said. But for those children and teens living in rural areas or outside of downtown cores where there are services accessible, oftentimes perhaps signs of depression or anxiety might not be taken as seriously, or they don't have the ability to triage them or move them to the front of the line. Do you have any advice for families that don't live close to that central care, especially in a virtual world, of where there could be resources that they could access?
Yeah, it's a great question, and in some ways this pandemic has moved our systems along a lot faster than we had maybe planned, and really motivated us to think beyond geographical boundaries when it comes to providing services, so that virtual mental health services are actually fairly accessible and available, and that's something that we can actually provide you with if you want to provide the audience with later on some places to look at and go. Yeah.
Fantastic, thank you. And Dr. Katzman, we received a follow-up question around screen time. And I've been in this situation as well. When you remove the phone or the tablet or turn off the TV and the meltdown begins, while trying to balance, how long we should be doing. Any advice for parents on that, or is that, as we are in the terrible twos, and that will continue to happen?
I think it's important to have discussions before those meltdowns occur and make sure that the teen knows sort of the expectations and limits of using screen time. And then when they go beyond those boundaries and you have to make those decisions, I think it's easy. It may not be appealing to them, but it may resonate with them as to why you've carried out with those actions.
That is perfect. I will take that into consideration the next time I am removing a device. Thank you. A few more questions that we have, especially around the research all three of you are conducting, and Dr. Katzman, I might start with you again with this one, but what questions are driving your research into some of the issues we've discussed today? And it doesn't have to be just the three of you, but within teams that you might not otherwise be collaborating with, has this brought you closer together to kind of solve some of these issues?
So I'll speak from the eating disorder standpoint. We're currently involved in several studies in collaboration with pediatric eating disorder programs across Canada. And our hope with these studies is to provide information on the magnitude of this problem, because as Dr. Monga described at the beginning of this discussion, this is not what we're seeing in eating disorders, and this surge in eating disorder is not unique to the Hospital for Sick Children. We're seeing it across Canada, we're seeing it across the world. And so part of what we're interested in studying is the magnitude of this problem here in Canada. We want to explore the severity of the patients that we're seeing, and we want to look at individual and family and other sort of pandemic-related factors that are driving what we're seeing and the severity of the children that we're seeing. The other thing that we're hoping to be able to learn about is how to best adapt and modify and deliver needed services and supports to children and adolescents with eating disorders and their families, both during this pandemic, but in the case of future health emergencies. And hopefully through these studies that we're doing, we'll be able to sort of translate this information into really pragmatic ways of caring for young people in times of crisis.
Right. Dr. Mongo, I'll turn to you around that. What's driving your research and how the collaboration is working?
Yeah, well, I think similar to what Dr. Katzman has just shared, there's a lot of collaboration around you know, what's happening across mental health worldwide with the US and worldwide. So Dr. Korczak and I are involved in a number of, you know, like looking at what are the numbers elsewhere, and we're seeing similar, you know, numbers there. And so that kind of, you know, collaboration is happening. I think kind of more internally, if we think about things, mental health has really pivoted to virtual care. Back in March 2020, we kind of really, our department pivoted almost completely to virtual care, and we're doing a number of studies to look at, you know, what is virtual care like. So right now we're just focusing in on the feasibility and kind of what's happening with virtual care. At some point in time, it would be really interesting to do some kind of study where one is looking at, is virtual care better or equal to in-person care for mental health conditions? So those are some of the things that we're kind of exploring and doing from a research lens within the department.
And Dr. Korczak, anything to add to that around the collaboration and questions driving your research?
You know, for us, this research, the COVID and kids mental health study, has actually been a very collaborative project. It's been pretty exciting because what we've done is taken 4 existing, already successful research groups, and we've collaborated across them all in order to understand the impact of the pandemic. So in and of itself, across Ontario, that is kind of an exciting collaboration, and Dr. Mwanga, as she mentioned, is part of the collaboration as well. We're also collaborating within that with other centers, and we're collaborating with some partners in the US around this measure, particularly as it pertains to children with autism spectrum disorders and neurodevelopmental disorders, so that we can try and understand a little bit more in a more nuanced way how the pandemic is affecting that group of kids as well. I think when future questions, things that we are probing, you know, we are in the midst of looking at quite a lot of things related to children and families and their environments. I worry a little bit about the effects of prolonged social isolation on vulnerable kids, you know, especially those that haven't been in-person school at all for the last now a year. Clinically, you know, I see kids who haven't seen a friend in person in months. Previously healthy kids who used to be engaged in school and active and in life that now don't seem very motivated to participate in school. And kids who just don't seem to be able to buffer the day-to-day frustrations compared with their pre-pandemic selves. And so I worry about how we can get them back into school and back into activities successfully. And that's one of our aims, is to understand the best approach to identifying and helping kids that need it most inside and outside of school. And then looking at, you know, we make some assumptions and trying to understand, you know, the amount of screen time, for example. As Dr. Katzman said, at the moment, you know, people are in survival mode to some extent with respect to, you know, if we need to use screens to encourage social interactions, then that's what we have to do. And we hope that it's better than non-face-to-face screen time. And we hope that that's true. But one of the things that we want to examine in our research is whether that actually is true and what the impact is on mental health, and whether one is better or worse than the other. So these are some of the things that we're thinking about, some of the things that we're turning to look at over the coming months.
And Dr. Korczak, just to follow up on that, we received a question around, you know, the isolation that school is causing some kids, and, you know, not having seen, for some kids starting new schools, it's hard enough in person for many kids and their families and parents. Do you have any advice for maybe the kids, but maybe more so the parents, and how to facilitate introductions in the world that we're in? Or facilitate friendships, if I can go so far to say that.
Yeah, no, it's an excellent question, because kids in transition are definitely a vulnerable group. It's something that we've seen across transitions in general at different points, but certainly within the school system, kids in transition constitute a vulnerable group. And we have something that we were looking at for the 2019-2020 into this school year, 2020-2021, and something that parents are now having to face again for the upcoming school year. And so kids who are moving to a new school, kids who are moving to, let's say, middle school or a high school for the first time, these are already points of vulnerability. And when that happens without being able to see the school ahead of time, when children are trying to choose a program without really ever having the chance to have that open house, let's say, go see the school, meet the teacher, really get a sense of what is this environment like, but now I have to choose and I have to go there. And then when they get to a new school, not knowing their way around, wearing the masks, being sort of cohorted, these are all elements that contribute to the reason that being in a period of transition is as a point of vulnerability. So if in that situation, there are a couple of things that are really important. And one is homeschool connection. Because although the research in this area is fairly limited, one finding that has been robust, that we have seen again and again, is that when there's a good homeschool connection, when kids are supported at home and home is speaking with school, even if they're adolescents, that kids do better from a mental health perspective and an adjustment and an academic perspective, actually, in terms of outcomes. So being able to communicate with the classroom teacher, or depending on the level, even with the principal, depending on the school system and the school setting and the period of adjustment, but being connected. How is my kid doing? What's going on in class? How can I support that at home? These are some concerns. Are you seeing them in the classroom? Like just being able to have a dialogue from time to time with the teacher, and continuing that communication is really important. The other thing that we're seeing that schools are mindful of now, but that is also really important for this group of kids, is group work. So that's not something that we necessarily see or think about too much, especially in a virtual setting. But we can do breakout rooms in virtual settings. We can try and get into smaller groups. Some sense of interaction is really important, so that kids are not just sort of sitting at their desks independently doing their work, because that contributes to feelings of loneliness and isolation. So those are a couple of things but to think about, but that's certainly, it's a great question and it's really important.
Yeah, thank you so much. Dr. Mongo, we have recently launched a very exciting mental health strategy at SickKids, and I know you've been very involved with it. Can you talk a bit about how it will help tackle the crisis that we're in, and how it was launched, and really the vision of it for the next, hopefully 10 years plus for SickKids and the country of Canada?
Wow.
In 2 minutes.
Well, thank you, Colin. I mean, I think it really is a visionary kind of mental health strategy. It kind of launched in 2020. It's a SickKids-wide, enterprise-wide strategy. It's not a department of psychiatry strategy. It's inclusive of, the hospital, our community site, the Research Institute, the Learning Institute, and it's really kind of with the goal of harnessing all of these great resources and really impacting mental health outcomes in children and youth. And we started about 1.5 years ago, before the pandemic, with the kind of developmental stage, and we really engaged with key stakeholders. Like, we had over 400 stakeholders come to us, provide their input, and that was, across the hospital, across community, but most importantly with patients and caregivers, and really to get their input. And now we are at the implementation phase, and it's a daunting task, but we really believe that this expansive strategy will be the first of its kind in the pediatric field. And its goal really is to focus in and prioritize on the integration of mental health into all the great physical health care we do. So really kind of impacting the hospital at all levels. So the child coming into the emergency department with only a mental health concern, it's going to kind of impact them, as well as the kids on our medical and surgical floors. And with this kind of strategy moving forward, we really, our goal is to really impact the mental health outcomes. And I think that that's a really important goal, given what you've heard over the last little while about the high volumes, the acuity that we're seeing. And so we're very excited about the mental health strategy.
As I mentioned at the beginning, with the Slate Family Foundation's Gift Philanthropy plays such a role in helping to achieve that and enable it. So as I said, we're grateful to all of our supporters, and definitely there's always more need and more willingness to support this area specifically of SickKids. So thank you for sharing that strategy, Dr. Manga. In the vein of that strategy, I know that child or family-centered care is such an important part of everything SickKids does. And Dr. Manga, we've had a question come in around how do we work with siblings, and how do we ensure that they not are kept away from any of the other children that are experiencing mental health disorders or illnesses, but how do we speak to them? How do we work with them? Do we still feel like part of the family?
Yeah, I think, you know, family-centered care is so important, and it is kind of what we do at SickKids. It's really working with the whole family, and we have been doing some of that, but I think that that's really one of the things that we heard loud and clearly that maybe we need to do more of with the mental health strategy, and that's really up front and center about how do we look after siblings, how do we look after parents when a child has a physical health or a mental health concern. Like, to really do that in a better way is one of the priorities of the mental health strategy. So yeah.
No, that's very helpful. Thank you. Last question that I'm going to pose to all of you, but I want to end by giving you each a chance to share resources that you know are very important or helpful for parents, families, teens, adolescents, and where can they go to seek this? So I'll ask each of you from your perspective in terms of your expertise, but Dr. Manga, maybe we can start with you.
Well, I think the About Kids Health website that SickKids has, the SickKids About Kids Health, they have a mental health platform. I think many of us have, I know Dr. Korchak and Dr. Katzman have written on that, myself as well. There's a lot of great information on that website about anxiety, about depression, about eating disorders. They even have some great meditation vignettes and recordings. So I think that that's a great site to be thinking about, and I'm sure we could put that into the chat about what the website is. So that would be my first thought. Great.
Dr. Katzman?
I want to emphasize that I think About Kids Health is a great resource for people. So that would be my first stop. The other resource that I have is Feast, F-E-A-S-T, which is a website for families who have young people who have eating disorders. So you can go there and get lots of information and support from other families who are going through managing and supporting a young person with an eating disorder. And if you have questions about resources in your particular area, the National Eating Disorder Information Center is also a very good resource.
Great. And Dr. Korchak?
I think those are all good resources. I do often recommend the About Kids Health website as well. I would maybe add the Kids Helpline. Kids Helpline actually has developed their website quite a bit, and there's quite a lot of information on that site now, and there's some really nice, excellent information for kids and also for families that one can look at if you are searching around the site. So that's also one to think about.
Great, thank you. Well, you've all said the two sites that I was going to direct our guests to today. If they're feeling any distress or unwell, please visit aboutkidshealth.ca or kidshelpphone.ca, two amazing resources that we're very proud of. And I want to take this opportunity to thank Dr. Katzman, Dr. Korchak, and Dr. Manga we have called on you many times, as I said at the beginning, to help us out on the foundation. So we're grateful for the time that you've given us and for the expertise you've shared with our guests here today. So on behalf of SickKids Foundation, thank you so much for participating. And to everyone that is on the call, please thank you from the bottom of our hearts at SickKids Foundation for joining us. Please feel free to reach out to anyone at SickKids Foundation. And we hope you have a really great night, and there is hope in the future. And so please, let's stay positive and support one another. So thank you and have a great evening.
Thank you, Colin.
Thank you, Colin.
You.